Assalamualaikum guys, welcome back to my YouTube channel, and today we will discuss a very hot topic by examiner about the red flags of neck pain. So if you are a physiotherapist and you are trying to applying for the jobs in UK, and you are preparing yourself for the interview, so this video is for you. And in the end of the video, I will tell you what questions the examiner can ask from this specific topic. So let's get started. First of all, I would tell you about the red flags. So what are the red flags? Basically, red flags are the sign, that indicates that something is happening wrong inside of the body. So you should must consider to evaluate the red flags during the history, so that you cannot skip any serious underlying pathology. So what are the red flags of the neck pain that specifically related with the neck pain? If patient came to you and he has neck pain, and what are the other symptoms if he is presenting along with the neck pain? So we should must consider those symptoms, right? So let's get started. What are the red flags of neck pain? So guys, here we will discuss that what are the red flags of the neck pain, right? So first thing is that if there is severe pain and the pain is persistent, and the pain that doesn't respond to over the counter medications, right? So if he is taking medicines, painkillers, and his pain doesn't improve, so we must consider that there is something underlying pathology. Then the radiating pain, if there is pain that radiates down the arm into the shoulder blades, accompanied by numbness, tingling, or weakness in the arms or hands. Then there is fever. If patient have neck pain, and along with that he's having fever, and that could indicate there is infection such as meningitis or deep neck abscess. And if patient has difficulty in swallowing or breathing, so it means that there is serious conditions such as epiglottis or throat abscess. If there is history of trauma, neck pain following a traumatic injury such as a car accident or fall, like whiplash injury, and progressive weakness or numbness, right, that indicates the spinal cord compression. And unexplained weight loss, right? If patient has a history of unexplained weight loss, then you must consider the underlying conditions such as cancer. Then pain that worse at night, right? Again, it could be due to tumor, it could be due to any infection. And then there is persistent headaches, and persistent headache, neck pain that accompanied with the visual disturbance, then there must be something serious. Right, so what are the conditions that present with the red flags? First is the cervical radiculopathy, right? And second is cervical myelopathy. So examiner can ask from you that what are the symptoms of cervical myelopathy, or what are the red flags of neck pain. So you can tell the examiner about the red flags, such as the difficulty in walking, the balance disturbed balance, and the bowel and bladder disturbed function, bowel and bladder disturbed function. And along with that, any numbness or nausea, difficulty of swallowing, and slurred speech, and double vision, and dizziness. So these all are the red flags. So if the examiner specifically asks you that what are the symptoms of cervical myelopathy, then you should stick only to the cervical myelopathy red flags, right? So the cervical myelopathy red flags are those. The important one is the clumsiness of hand, and difficulty in walking, disturbed balance, and change in bowel or bladder function. So patient will drop things very often, and there will be weakness in the upper limb extremity, and the balance will be disturbed. So if patient and if the examiner asks you what are the 5 Ds and 3 N, So you should tell them that it is, related to the VBI, that is vestibular basilar insufficiency, in which, there is lack of blood flow to the back of the neck and head, and it happened due to hardening of your arteries due to atherosclerosis. And patient will present with the 5Ds and 3N and 1A. So what are the 5Ds? The 5Ds are: one is the double vision, the dizziness, drop attacks, and the dysarthria, dysphagia. And the three N's are the nausea, numbness, and nystagmus, and one is ataxia, right? So these are the symptoms, red flags that related to the VBI. So what are the red flags that present with the meningitis? So if there is infection, the patient will mostly present with the fever, and other than that there will be headache, nausea, vomiting, sensitivity to light, and altered mental status, right? So these are the red flags of patient presenting with the meningitis, and in severe cases it can lead to life threatening complications. Like then we have the neck trauma. So if patient has a history of car accident, and then you can tell the symptoms that related to the whiplash injury, and what are those symptoms, like the red flags that include severe neck pain, loss of consciousness, weakness or paralysis, difficulty breathing or swallowing, and changes in sensation or movement in the arms or legs. So sometimes the examiner will give you a case study, and you have to make the diagnosis, and sometimes they ask you like what are the symptoms of that specific condition, or sometimes they can ask you what are the red flags related to that specific conditions. And sometimes they also ask the medicine, the over the counter medications, and sometimes they will ask you the physiotherapy management, and they can also ask you the how you can take history, right? So these are the questions that examiner can ask from you. Okay, then other than that, the inflammatory disorders, conditions such as rheumatoid arthritis or ankylosing spondylitis can cause inflammation and damage to the neck joint and surrounding tissues. So red flags may include persistent neck pain, stiffness, swelling, and fatigue, along with the systemic symptoms such as fever and weight loss, right? So if your patient got one or two red flags, like cluster of red flags, two or three red flags, then you must consider your patient for emergency referral, so that your patient can take the appropriate medication and appropriate medical management. So guys, here are the red flags of the neck pain that we have discussed in very detail. And okay, so now come back to the questions.